All right, this video is going to be for the clinicians, the licensed clinicians that are going to be supervising students for for the physical therapy EAC. So this is going to be the dashboard. This is the first screen that will typically open up as you log into your Practice Fusion. The first thing that you'll do is at the very top, at least in the real medical record, you'll see your name at the top. The training one, you won't see that, and that's just the nature of the beast. But once you've identified your name, you're going to go over to this little drop-down menu, and in the real medical record, you're going to have the option of EAC, physical therapy. So just make sure that you are in that department. I'm going to try to get that set up on the back end so that it'll automatically populate that, but just in case, make sure you move into that facility. So, and again, that's EAC physical therapy. Now, once you are in here, the big thing that you need to start off with is just this task section. Now, in this record specifically, because this is just a practice record, you're not going to see too awful many tasks, but there are going to be tons of tasks in the real one. You're going to click on that. Once you click on that, you're going to see a whole bunch of both super bills as well as encounters that need to be signed. The easiest way to narrow this down so that you get straight to your student's record that you need to sign off on is to change, oops, apparently that registered my click, so let's go back to the patient list. Okay, so from here you'll basically click on all providers, and then you'll scroll down to that student's name. It does appear that these are listed by the first name as far as an alphabetical order is concerned, so just scroll to that student's first name. Once you scroll to that name, only the medical records that are assigned to that student will pop up. So if I click on test, it'll bring up just those records. In this case, if I click on Kim's name, it'll bring up just the records that I falsely created, or the fake ones that I created for her. So once you get there, you're going to have the option to sign. Don't worry about clicking on this and thinking that you're going to accidentally sign on or sign off on something without looking at it, because what it does is it'll open up that record so that you basically have to look at it for validation of what's in there. In chief complaints, some things that we are looking for is if it's the very first session for that patient, they've come in for a new evaluation, this top line should read as initial evaluation. And you can have your complaints of shoulder pain. Ideally, we want to have a functional statement in here too. So complaints of shoulder pain described as being sharp, 3 out of 10. That's limiting X functional activity. Then you have got your basic vitals information, so you'll have the BP, pain numbers, and whatnot. From there, a diagnosis should have been picked. It's not directly under diagnosis. You'll see it under these lighter blue color ones. If it's low back pain, shoulder pain, they're in there. Now, of note, if it's a medical or a med EAC patient that we are now seeing after they've already seen them, they likely will have these diagnoses auto-populated. So don't worry about messing around with that. Just make sure that the diagnosis that we're seeing that patient for is in there somewhere. You've got allergies, of which the students can insert on the first go-round, so you can clarify with them in that case. You've got some medications. Just quickly look at these and make sure they make sense in general. Do know that these can also be inserted via Med EAC, so I would confirm with the student before you make any changes to any of these. Next, you'll move into smoking. You've got the various options. That's pretty much all you get in there. Some past medical history is offered just with ongoing medical problems. Just because I haven't shown it so far, for the most part, these do include some open fields that you can start putting some information in. So if you wanted some more social history, you could enter it in here too. And that'll pretty much pop open for each one of the record ones. It'll either give you a big opening like that or just a text field. Once you get into the note, this is going to be the bread and butter of everything that we're doing with the patients. You've got a typical SOAP note format. What's nice here is that if you click edit, you can go in there and change it. It is more of a Word document. You do have some templates that can be chosen. We're going to try to keep these relatively generic. That way the medical record is not guiding the student's clinical reasoning. It's actually the interaction with the patient that's guiding that. So these will be pretty basic. If you like what you see, you can just hit go to objective versus closing it out and moving in slowly. So if you just click go to objective, that'll pop up the objective, see if you like what you see there. Go to assessment, same thing. Here are some basic sentences that we do want to have in there, which would be how are the impairments that we've related, and we're talking about the major impairments, not all of the impairments, but how are those related to the functional limitation of which the patient is presenting to physical therapy for. And then how or why they need physical therapy to address that. So how does PT relate to treatment of those impairments? And then a prognosis statement. So how's that patient going to look at the end? So those are the main things that we're looking for in that assessment portion. And if I click go to plan, this is where we're going to come up with our typical 1 time per week for 4 weeks using these modalities and whatnot. If you wanted to put the duration of the visit, you can put that in there too. Now, because there's not a good section to put in our goals, we're going to insert the short-term and long-term goals here underneath the plan. So that's where those will be housed. We are looking for these to be both measurable as well as them being ideally related to those primary impairments. So those are things to keep an eye on because the students oftentimes aren't doing quite as well in this area as we'd like them to do. So you hit done, and then any changes that you've made will now be in this area as a text. Attachments are nice. We're using this to really house any referrals that have come in or any paperwork that the patient presents that it would be easier just to have an image of. So that can be uploaded. This is going to work best with a computer source. I believe it works with the iPad as well as the Android devices, but definitely with a computer source. So you can attach information there. Screenings, interventions, and assessments. Unfortunately, this is more of a search box, so it's not going to help us out too awful much. So any kind of intervention or whatnot that you've provided for the patient during that first session, just throw that in the back end of objective. That way they've got that information there. If it is a exercise flow sheet, we actually do have the ability of pulling that forward. So. Next one, we've got functional status. Since we addressed this in the assessment and plan, I really wouldn't worry too much about this, whether the student has it or not. Just know it's there. We have told them that if there's a cognitive impairment or there's any kind of necessary health advocate to have that information here. Otherwise, just put no cognitive deficits. This should say deficits noted. And you can also change that. Unfortunately, it does tend to clear out what you had, but none noted, and then from there you just click and then you've got the new one there. Plan of care, we don't really need to worry too awful much about this one since we're putting the plan of care in the actual plan section, so don't put or worry about that. This referral portion, it does seem like it's an area that you can add a referral, but in general you're going to click on this if you feel that that person is not appropriate for PT and their physician or a physician that they've seen is inside of the Med EAC, because then you can type in that person's name and then you just start using their information. And actually in this case it does seem to be something that's just not built out in this specific version of the medical record, so we don't really get a chance to show you the recipient. But again, this is more for us to refer to someone. So once you're done with that, we're not doing super billing since it's a pro bono clinic, so don't worry about that portion. Once everything looks good to go from what you have seen, you just click on sign. It'll give you the little warning saying, hey, you're getting ready to sign this. You can just click on that and voila, you are done. It is officially finished. So these are just some old notes that I had previously created, so you'll see that the original task is no longer here. So those are the main things that you would do from that aspect. If you happen to need to do a patient treatment, that same information you would just go through the same process. So if it's a patient who has been seen by the EAC, the students before, you would click on charts. That will open up this area. You will be added to a provider, so you could search for yourself as a provider. Again, it's going to have everybody in there. I believe they are listed by first name. So just search for yourself, and that'll help you narrow it down. If you've never seen them before, you can do the same thing that we did before, where you would do a search based off of that person's date of birth. I would recommend doing that versus searching for social security numbers and whatnot, since we don't plan on collecting that information, and I'm not sure if medical EAC does or not. So you get in there, you'll click test. That'll open up a dashboard for the patient. Once you get in that dashboard for the patient, you'll see this orange box. There'll be some different drop-down choices. One of them might be evaluation. So if it's a new patient, you might see that and think that you want to click on that. Don't click on that. For some reason, it's got a lot of stuff in there that we are not able to manipulate. So don't waste your time with that. Just use that SOAP note. And once you click on SOAP note, it will load in another note for you, of which you'll go through, verify that this information at the top is all correct, and then you would progress through the record just like we did a second ago when we were cleaning up the information for the student. And then obviously once you're done with that note, you can go ahead and just sign off. So I hope that gives you a nice overview of what we're doing with Practice Fusion for medical EAC. If you have any questions, by all means, either ask myself or ask the student leadership. Thanks.